Welcome to the Recovery Playbook. I'm your host, Daryl Shorter.
And I'm your host, Ryan Leaf.
Today, we are going to demystify treatment. Ryan, maybe tell us a little bit about your journey, and then we'll go through it.
Let's open the curtain to what treatment is. I think that stigma puts up a very large veil in front of it because people don't want to talk about it. In fact, the idea of anonymity around it, right, is such a huge thing. Of course, protection of your medical diagnoses and everything like that. I find it different for me simply because when you find recovery, like, you're not ashamed of any of it. In fact, you want to talk about it more because you know it's going to help someone else. So people are always at different points along their journey. And the first one, usually the first time someone may ever have to go to treatment, usually forced, right? It's usually through an intervention or ultimatum. And so they come in kicking and screaming.
So did you have to go to detox first, or what was detox like?
I'm trying to think. No, I didn't have to go through detox my first time because there was about 7 to 10 days in between when we decided to go, and I was kind of under lockdown with your family that I couldn't get.
Did you have to go through withdrawal?
I did.
And you kicked cold turkey.
And I did it silently, away from my family, down in the basement. No one understood what it was about. And now the ability in these treatment facilities to go through the detox process to limit the withdrawal symptoms, actually stop the cravings and allow you to start getting to work immediately, I think has absolutely advanced beyond belief.
Yeah. So I think the first thing people should know is that if they have a substance use disorder, that there's a period of time that they'll go through where they have a withdrawal syndrome, and that will probably need to be managed with medications, and not all the time, but certainly for things like alcohol, benzodiazepines like Xanax, opioids.
Or it could be very dangerous.
Or life-threatening in the cases of alcohol or benzodiazepines, or if people are using lots of substances in combination.
And then, of course, the third and final time, my withdrawal process went in solitary confinement in a jail cell, which
brutal.
Was, worst place that anybody could be is inside my brain, okay, for that amount of time. Treatment, I have come to understand, because you never have been open to it. I walked into it, I sat down in these rooms and I looked around, and as alone as I felt as a drug addict, I felt immediately like I was at home. Everyone in that room was just like me. They were this flawed human being really trying to be better.
But everybody in this room is just like you,
yes,
because we're all flawed human beings.
But you never felt necessarily that way until you learned the process. And I also think it started to diminish the stigma. I thought AA was where all the bad people went. Like you were sentenced to it. Instead, you realize that the people at AA are maybe the best possible people in the world because they figured it out, right? And they know they're messed up, and they are finding ways to do it. I always say this, that there should be a prerequisite for people when they graduate high school, if they're not going to college, or if they graduate college, that they have to go to treatment right after that as a prerequisite. And people look at me and I'm like, it doesn't matter if they have a problem or not. Where in the world would you go and focus on, 28 to 60 days of treatment on bettering yourself? Okay,
so what does that look like practically for somebody? How am I spending 28 days?
I think that it can be through outpatient type of things. I actually think you should just go, into a facility, lockdown facility. I should say lockdown, but inpatient facility.
Okay, but that's important, right? So why might somebody be locked down versus not locked down? Okay, there's a couple of different reasons why that might take place. So locked psychiatric facilities typically offer treatment to folks that might have some sort of dangerousness to self, potential for harming themselves in some way, and that might be that they're perhaps experiencing suicidal thoughts of wanting to hurt or harm other people, or they're having mental health symptoms that might make it difficult for them to kind of be able to take care of themselves. So they might have symptoms of psychosis, they might have symptoms of mania if they have bipolar disorder, or a combination of those things. So inpatient, it looks a little different from residential, where the door is actually not locked.
Yeah.
People can come and go as they please, and it's a voluntary, in both cases, it's hopefully voluntary, but residential treatment tends to be voluntary. People can come and go much more easily.
Yeah, and the fact that let's put it this way. So you go from this incredibly chaotic world that you're in, whether that's the overwhelming nature of just finishing school, or if you are being intervened with, it's complete chaos, going into a very structured, very safe environment. And there isn't the lure or the trigger of substance that you're using or whatnot. You're in a place where it's all about wellness. I mean, the food, the exercise, the psychotherapy, the peer-to-peer, all of that stuff. And you do this for 28 or 30 days. And then, let's say that you feel like, well, what anybody does, and we call it the pink balloon kind of scenario, you think you got this thing licked. It's 28 days and you're like, I'm a new person, I've been clean for 30 days or whatever it is, I feel like a new man, ready to go attack this. Well, it's like being released into the wild after being in captivity. You've been safe, there's been safeguards in place everywhere you go. You walk back into the world and your muscle memory kicks in. You've been this way for however long. In my case, I like to think about it took me 38 years to get to a place where I finally figured it out. I probably won't get this done or be right until I'm 76, and then I might have some knowledge to all of it. But you got to look at the fact that maybe your family or your or whatever you consider your family didn't do any work while you were in there, while you were doing work. So their reactions to you are going to be very similar, which your muscle memory is going to take over, and your reactions to them are going to be very similar to what it was in the past. So there's always a continuation of care, in my opinion, that is helpful. In my case, I stayed 90 days the last time I went through, because I know that the 30-day option didn't work for me, right? I needed more intensive therapy, understanding, and I was really focused on it this last final time. And then after that, I looked into a sober living environment where I was going to, not so much to have the environment, because I was never really around drug users. It was always about me. I wanted some accountability, is what I wanted. I wanted somebody holding me accountable for things, whether that be through drug testing, when old behavior crops up, being called on it. I had been asked by my sponsor simply, what are you willing to do to stay sober?
So what's the difference between sober living and residential treatment?
It's a good question. So sober living is just an environment that is a safe and drug and alcohol free, with some parameters, a curfew usually.
So the continuation of structure,
Yes.
like you mentioned. Okay.
Continuation of structure around like-minded folks, people who are trying to stay sober, who are recently released from inpatient facilities, and monitored closely by, usually a lot of times former clients or people who work in the field it's exactly what I did. I started working in a sober living home as a driver, to learn service to fellow addicts and alcoholics. And so that
And
helped.
another important point about sober living is that while you are in sober living, people can also do some of the non-residential types of care, like an intensive outpatient program where you may go 3 days a week,
Yep.
or a partial hospitalization or day treatment program where you may go every day and continue individual therapy, group psychotherapy, family therapy, seeing a psychiatrist and doing some other medication.
Yeah, I think that a lot of people think it's like this one serving type of thing. You go to treatment for 30 days and then you're good to go. No, this is a continuation of care. It's like anything. You may be, in the way that the physicians look at it, as a substance use disorder individual who's in remission. But you still have to do all the work to stay that way. And so my case, I saw a therapist while I was in sober living. I, got a trainer for a gym. Worked with a nutritionist in the house around my habits of eating and what I was putting in my body. Very similar to anything anybody does is processed sugars. We don't think of that way, but we're hitting a certain receptor in our brain because of it, just like we do with the substance of our use. And it allows you then to see things much more clearly because you're not craving, you're not seeing things from somewhere else. You are actually looking at it from a wellness model. And that's what I think the continuation of care. And for me, I did it from entering the treatment center to ultimately when I was out of the sober living environment, from start to finish was 18 months for me. And it's what I recommend to most families when I'm working with them around what a time frame is going to look like. And it's usually just met with outrage because how am I supposed to uproot my life for 18 months? I have to work. I have
responsibilities.
Yes.
Yeah, of course.
And my response usually is, well, you're going to lose all that anyway. It may be sooner or later, but you're going to lose all that anyway.
So one of the things that I think can be helpful for folks to understand is that there may be a component of this where, yes, it does require that you are in a hospital. You might have to have your withdrawal symptoms managed by somebody who is giving you medication, and that period of time may take anywhere from 1 to 2 weeks, depending on the substance or substances that people are using. Then from there, you might step to either an inpatient or a residential level of care, depending on whether or not there are mental health symptoms that are present. You might do that for any period of time, maybe 30 days, 60 days, 90 days. And then from there, you can step down to some of these other levels of care, like a day treatment program or an intensive outpatient program where you are living at home. Some of these programs are even offered in the evening so that you can work and then go to intensive outpatient in the evening and kind of get back into your life and integrate in a different kind of way.
And it will also train you to when you are out back there in society, continuation with that care. I still see a therapist. I'll be 12 years sober here in about 10 days, and I still see a therapist every other Wednesday night. And my wife and I see a couple therapists from time to time, simply because we want to communicate better, not because there's an issue. And this is all just with an understanding of what can benefit. As an athlete, I trained my body like it was, a temple to perform. Why would you not do that with your brain?
Stigma.
Yeah. Every episode could be about stigma. It always comes back to that and what's limiting of people. So our hope is that you watch this podcast, with your family, or if you have a loved one who's dealing with stuff, so you have a better understanding of what they're going to go through and how difficult it's going to be and how uncomfortable it's going to be, but how amazing it will be. And the best spokesperson for any of these facilities are the people that graduate from them. Because, I have yet to find an individual who's gone through it and have the same type of anonymity that they had going into it. They're like, oh, I went to the Menninger clinic and it's the best freaking place that I've ever been, and it gave me my life back, because you don't see people trying to hide that fact if they're really living that life of understanding of it. So, from start to finish, it can be a very lengthy period of time, and it will ultimately be how you make it in terms of those 18 months are some of the best memories I have of my life because of what I learned and the place it got me to.
At the end of the day, you do not have to wait until the crisis happens. You can start engaging in care before that. Do not wait until the crisis happens.
Yeah, you don't have to wake up on the floor of a jail cell to figure it out. It's what was needed for me.
Yeah.
I had to be humbled in that way. I'm incredibly grateful for it. I don't recommend it, but that's why we're here. That's why we're here to talk about it.
All right, so the play is don't wait for the crisis.
Don't wait for the crisis. Ask for help.
We'll see you next time. Thanks.